get organized. One of the things I think is really positive is how we've been able to refresh in our organization. And I'll just take an informal poll here. How many people joined Rouge Valley in the last 3 years? And also, I was at new staff orientation this week. I try to go every time. And we had 39 people. It was the biggest group of new staff I have seen in the 2.5 years that I've been going to orientation. So it may not seem obvious to us every day, but we are bringing new people into the organization. And it's not because we have tons and tons of people leaving. It's because, as John said, we've been given some good opportunities to grow in some areas, start new clinics, start new programs, etc. Yes?
We could also look into a staff retention program.
Staff retention, great idea.
Because focusing on a healthier workforce. We were requesting if we could have a physical sort of facility where we do some exercises, because sometimes we would want to go up with a cardiac floor just for, for physical wellness. We don't have access to that. Right? So if the organization can look into the physical,
That's a great idea. And I'll
just focus on bringing new people,
yes,
staff retention,
and keeping the great people that we have. So I'll just repeat that because there are folks all the way at the back of the room. It was a suggestion about how important it is to look at staff retention. And one of the things that we could do is provide some facilities for people to exercise during the day. We can't always go up to the track up in cardiac rehab. Sometimes that's being used. So I know that there are folks from Human Resources here, and they're always looking at ways to improve our healthy workplace. So thank you for that. And did you want to comment at all?
No, absolutely. Those are areas that are part of our housing workplace strat plan. Is more of an opportunity that will assist in fitness, stabilizing disorders, and prevention.
Okay, great. And we'll hear a little bit more about injuries in a healthy workplace a little bit later. Let me just move on then. Is that okay? Any other questions? Good. John said that he always likes to start his reports by talking about the volume of services that we provide and how we're providing service to our community, and then he gets into the financial piece later. And that's really consistent with our overall mission and vision as a hospital. We always want to put the patient perspective first. So that's why we're really pleased that we were able to complete a really important piece of work in the last couple of months. You've probably heard about it, I hope so. It's called the Patient Declaration of Values. And this is actually something that is now a legislative requirement. It was written into the Excellent Care for All Act that was passed last June. So every single hospital in the province was required to develop a patient declaration of values, and it had to be completed by June 8th, because yesterday was the deadline. And now I'm doing the same thing. Let me stand over here. They had to be completed by June 8th. So we completed ours in May, and it was approved by the Board of Directors on May 24th. So you're going to see posters of this document all over the hospital in the next couple of months. The chairman of our board said he'd like to have one up in every single patient room, and we're going to put them in high traffic areas. We're going to get them translated. When you come down to Passport to Safety next week, you'll see a copy of it in your brochure. So it's really, really important. And what it is what we do is we asked our community advisory group to get us started in outlining what is important to patients when they come to the hospital. And many of us have been patients, or we know people in our family that have been patients. So I hope that we can relate to some of the things that are there. So what we heard was that quality, of course, is really important. People expect that they're going to get high quality care when they come to Rouge Valley. But in addition to that, they also expect to be respected, and they know that it's a two-way street. So when you read the document, it says that patients will also treat us as staff with respect and courtesy, and they expect to be treated the same way. And the third thing that we heard was really important for patients is that they want to have a voice. Gone are the days when patients just come in and do exactly what their doctors tell them to. Now people have access to the internet, they can get their own information, they're not afraid to speak up and ask questions. I know that many of you have experienced that in your day-to-day job. So quality care, being respected, and having a voice are the three main things that our patients are looking for. So you'll be hearing more about this in the coming months, and we need to find ways to integrate that into our day-to-day jobs. And we're also looking at ways that we can measure this, so that we can say to the board and to the community next year, you know, this is how we measure up against that patient declaration of value. So that's something that we're working on. Any questions? Yes.
I think it's great because from a customer standpoint, it's very important to service the patients and the families. But at the same time, you kind of hit it there where you said we too need to be respected as well. Since joining the hospital, I've never seen a sign where, like in the merge, I know my knitting staff, the patients come in and they're frustrated and they yell, but I've never seen a sign where it says we do not tolerate bullying. We won't accept harassment or anything like that.
Right.
That too, I think, needs to be important for all staff. I've been walking halls where family members just yelling at a nurse. Like I think it's very important. Customers do come first, patients come first. But I think too, it's a two-way street.
Absolutely, and there was, and the community knows that. And you're right. I think people. Oh, sorry. Let me repeat the question. The point was that it's really important to remind everyone, remind the patients and visitors that it is a two-way street when we talk about respect and courtesy, and that we won't tolerate harassment of our staff. So that's a really good point, and that is one of the things that when patients will see when we post this document, is that it also outlines what's expected of them from a respect perspective.
Just to add to that point, we do have a poster that has been. Thank you. Once you give this to me, you'll get it away from me. Just to add to that, we do have a poster that has been developed, and if it's not present in the emergency department, we can certainly reissue it. But and this is about respecting the staff, and it's posted at triages, posted in each of the clinical areas within the ED, as well as the fracture clinic area as well. So, one, if there's any other departments that want to have a look at it, we'd be more than happy to share it. And two, if the posters are missing from the ED, we can certainly redistribute it. I think I have a couple of extra ones still in my office.
Great. Thank you, Chris. Any other questions?
Just add a footnote to that. I understand that what was being said, thank you. But it is a two-way street, and you know what? Sometimes you have to figure out why the patient is frustrated, why they're yelling. They could have been through a whole slew of go there, no, go over here, don't do this, and then all of a sudden you're being pleasant, and they come up to you, and all of a sudden that's it, they've had enough. So maybe there should be somebody, I don't know, a gatekeeper, how are you doing, or everything's okay, I don't know, but you know what? People, when they're sick and their family members, and you know it, you get frustrated. And they don't intentionally take it out on you, but the frustration is boom. So, you know, you gotta understand that side.
Anyone else? Okay. Well, if there are no more comments or questions about that, I'm going to, oh, there is a question.
I worked at another organization, and their whole harassment in the workplace will not be tolerated, and I found it at that institution better than here, with what is tolerated and what's not tolerated between staff to staff, nurses to doctors. And we have it in the ARC, but it's not strongly enforced as it was at the other place that I worked.
Okay, well, could you give us an example or two of what they did at the other place that we should be doing?
It won't, like, doctors, like, speaking rude to you is not tolerated. So if they speak out of line and then it's witnessed and observed, it's not tolerated and they're spoken to. That's just one example.
So leadership steps in and speaks to the...
So like you don't have to be happy with who you're working with, but you have to get through the day, and and you have to be polite, because you wouldn't, like, the way sometimes staff speak to each other. I know they're frustrated and angry, but the thing is, like, you wouldn't go to Walmart and start screaming at the checkout. I mean, you might, but everybody's gonna look at you. You have to be polite.
Yeah.
Even if you don't agree, or even if you're in a situation, you have to respect one another, no matter if you're a PSR or the CEO.
Good point. So for folks at the back, the comment was, I'm sorry I don't know your name, but this, one of our staff was saying that she worked at another hospital where they did some things that I guess we don't do enough of here to show that they don't tolerate harassment of any kind, whether it's staff to staff, staff to physician, patient to staff. And one of the things is leadership stepping in when they know these things are happening and putting a stop to it. So we have a couple of new policies that we want to let you know about. So I'm going to ask a few people to come up and give us brief updates on these 3 new policies. So the next one, I believe, is the smoke-free policy. Dave? Smoke-free policy.